The child is suffering from steroid dependent nephrotic syndrome. His weight is 30 kilogram. Okay, so now usually a 7-year-old child with a 30 kg weight, it seems somewhat overweight or obese usually, and the height of the child is 106 centimeter. He is having truncal obesity, as they have said. What do I mean by truncal obesity? More fat or more weight is actually concentrated in the center or over the trunk. तो यहाँ ज्यादा मोटा है वो, ठीक है, हाथ पैर उसके पतले ही है. So the patient is having more truncal obesity with subcapsular bilateral cataracts. दोनों आंखों में उसको क्या हुआ है? Cataracts हुए हैं, subcapsular cataracts. Best drug for this patient is, now important is, as we have always did, क्या करते अपन? Nephrotic syndrome and nephritic syndrome, right? The basic difference between both of these are what? Both of these are types of glomerulonephritis. Glomerulonephritis is nothing but infection or the disease of the glomerulus of the kidney. Okay, it can be of two types. Either it can be a nephrotic syndrome or it can be a nephritic syndrome. If I talk about nephrotic syndrome, there are three important criteria. These are called as essential criteria for diagnosis of nephrotic syndrome. And what are these three essential criteria for the diagnosis of nephrotic syndrome? Very good. First one is proteinuria. How much proteinuria? Nephrotic proteinuria more than 3.5 grams per day. ठीक है, proteinuria of more than 3.5 grams per day is considered as nephrotic range proteinuria or a massive proteinuria. Second feature क्या होता है? Now, the protein which is lost, the major protein which is lost from the blood is definitely the most abundant plasma protein. कौन सा होता है? Albumin. So therefore the major protein which would be lost in the urine would also be albumin. So therefore there would be more and more loss of albumin inside the urine. That will decrease the levels of albumin in the blood, causing hypoalbuminemia, in the patient, right? And if the levels of albumin in the blood decrease or the levels of proteins in the blood decrease, which pressure in the blood decreases? So now there is one pressure which will push the blood outward. That is called as hydrostatic pressure. The other pressure which will pull the fluid inside the vessel. That is called as plasma oncotic pressure. Proteins will exert which pressure? Proteins generally exert the plasma oncotic pressure, due to which the fluid is pulled inside the vascular compartment or it is pulled inside the vessel. ठीक है, याद रखना है बस. Now here what has happened? The proteins are deficient. The proteins are less inside the blood. Therefore, the plasma oncotic pressure will decrease. As the plasma oncotic pressure will decrease, only pressure which is there inside the blood vessel is the hydrostatic pressure. Therefore, the blood will be pushed outside. More and more fluid would be pushed outside the vessel, and there would be collection of fluid in the interstitial space. And that is what is called as edema. The third important essential feature or criteria to diagnose nephrotic syndrome is what is called as edema in the patient, right? So that's important. You need to remember it's edema. And definitely edema, if it is generalized, मतलब पूरी body में अगर edema हो गया, पूरी body में अगर swelling हो गई, generalized swelling or generalized edema is what is called as anasarca. It is also known as anasarca. ठीक है? So that's the important feature again for diagnosis of nephrotic syndrome. Apart from these three essential features to diagnose nephrotic syndrome, what are the other features to diagnose it? Apart from this, in a case of nephrotic syndrome, the patient will have what? Increased amount of lipids inside the body. That is hyperlipidemia. Apart from that, now this excess amount of lipids which are present inside the blood, they will also excrete out in the urine. So the patient will also suffer from lipid uria. Okay? The patient will also have lipid uria. The third important feature, as I've told you, it is edema or generalized edema called as anasarca. Apart from these three essential features, the patient will have hyperlipidemia. The patient can also have lipid uria. Okay? So these are the features. Rarely, patient of nephrotic syndrome can also suffer from hypertension as well. Okay? Now, if I talk about nephritic syndrome, first feature is common. Because if the glomerulus is damaged, definitely the macromolecules like proteins will be filtered out from the kidneys and they will be present inside the urine. So here also the patient has proteinuria. But what range proteinuria? The patient will have proteinuria which would be less than 3.5 grams per day, or you can say around 2 grams per day, it would be the proteinuria. Second feature would be, here the patient will definitely suffer from hypertension. And the third essential criteria for diagnosis of nephritic syndrome is hematuria. What is hematuria? Presence of RBCs inside the urine is what is called as hematuria. Okay? So these are the classical features of nephritic syndrome. Now if I ask you, what is the most common cause of nephrotic syndrome in adults? Most common cause of nephrotic syndrome in adults. What is the cause? Answer is FSGS. What do I mean by FSGS? Focal segmental glomerulosclerosis. Okay? Whereas most common cause of nephrotic syndrome in children. What is the cause of nephrotic syndrome in children? Very good. It is MCD. What do I mean by MCD? Minimal change disease. Whereas if I talk about elderly patient, more than 65-year-old, most common cause of nephrotic syndrome in elderly patient is MGN. What do I mean by MGN? Membranous glomerulonephritis or membranous nephropathy, you can call it. Okay? Whereas if I talk about nephritic syndrome now, what is the most common cause of nephritic syndrome in adults or overall? If they do not mention any age, overall also and in adults also, what is the most common cause? Very good. It is Buerger's disease, also known as IgA nephropathy. Okay? It is Buerger's disease, also known as IgA nephropathy. If they ask you what is the most common cause of nephritic syndrome in children, then your answer would be पहले टाइम से PSGN चला रहे हो सब लोग. ठीक है? So the most common cause of nephritic syndrome in children is PSGN. What is PSGN? Post streptococcal glomerulonephritis in the child. ठीक है? तो यहाँ पे क्या होगा पेशेंट में? Both in Buerger's disease also and in PSGN also, the patient can have what? Infection with an organism called as group A beta hemolytic streptococci. Group A beta hemolytic streptococci is also known as Streptococcus pyogenes. It is also known as, और ऑप्शन में शायद ये ना आए तो दूसरा नाम हो सकता है ना, that is Streptococcus pyogenes. This Streptococcus pyogenes can either cause, patient में क्या cause कर सकता है वो? It can cause pharyngitis in the patient or it can cause a skin infection in the patient. क्या था वो बच्चा who presents to you with a skin infection where there is a honey colored crust? It is impetigo. Very good. So the patient can have a impetigo. Usually after pharyngitis or after impetigo, then the child develops hematuria, and this hematuria is described in the question as cola colored urine or a smoky urine. Okay? That is a classical feature, and it can usually occur after a span of 2 to 3 weeks. It can occur after a span of 2 to 3 weeks after pharyngitis, and usually after a span of 3 to 6 weeks after an impetigo episode. But usually you can remember after 2 weeks it will generally occur. If it occurs within after 2 to 3 days, then it has to be called as, very good. So please remember, if it occurs after 2 to 3 weeks, it is a case of PSGN. But if it occurs after 2 to 3 days, then it is a case of IgA nephropathy. No issues with this, anybody? Classically important. Chal. Now going back to our question. Now here they are saying that the 7-year-old child has a steroid dependent nephrotic syndrome. They have already told the child is suffering from nephrotic syndrome. And what is the most common cause of nephrotic syndrome in a child? So it is definitely MCD, that is minimal change disease. And minimal change disease can be of 2 types. What are the first line drugs to treat minimal change disease or nephrotic syndrome? It is definitely steroids. It is definitely steroids. Okay? So definitely most of the children with minimal change disease will improve with steroid administration. So the patients who improve with steroid administration, it is called as steroid dependent nephrotic syndrome. These cases are called as steroid dependent nephrotic syndrome. Whereas the other cases which will not improve with steroid administration, these would be called as, matlab, even after giving steroids for a long time, for around 3 weeks, 6 weeks, then also the child is not improving, then it would be called as steroid resistant. Very good. Then it is called as steroid resistant because the child is not responding to steroid. Okay? Then it would be called as steroid resistant nephrotic syndrome. Now, if it is a case of steroid dependent nephrotic syndrome, which has been mentioned in our question, definitely the drug of choice for this would be what? The drug of choice would be steroids. And what is the steroid which is given? Very good. Shabash. It is prednisolone which is given. Okay, it is the prednisolone which is given for a span of how many weeks? for a span of at least 8 weeks usually. Okay, it is given for a span of 8 weeks. So long term steroid therapy is given. Okay. If the patient develops steroid toxicity, now kya hoga? If you are giving steroids for a so long time, definitely steroids are not safer drugs, right? They have their own side effects. That is the reason why patient can develop steroid toxicity if you are giving steroids for a longer duration of time. So if the patient develops steroid toxicity, then what should be your drug of choice, guys? If the patient develops steroid toxicity, then your drug of choice should be a drug called as cyclophosphamide. Okay, it is a drug known as cyclophosphamide. If that is not an option, you need to give another drug that is called as levamisole. The other drug which can be used as well is called as levamisole. Whereas if they would have directly mentioned that the person is suffering from a steroid resistant nephrotic syndrome, rather than mentioning features of steroid toxicity, they would have said that even after giving steroids for 6 weeks time, the child's condition is not improving. Agar ye case hota, then it would have been diagnosed as steroid resistant nephrotic syndrome, and the drug of choice would have been then, it would be calcineurin inhibitors like cyclosporin, or the other drug which can be there, it is called as tacrolimus. So these are calcineurin inhibitors which should be given like cyclosporin or tacrolimus. So that's the basic idea. Now, yahan pe definitely the child was taking steroids for a longer duration of time, due to which what happened? The child developed truncal obesity. Because I hope all of you are quite aware, one of the major side effects of steroids is they cause truncal obesity due to a concentration of adipose tissue usually in the central part of the body. Okay, along with that, I hope सबको Cushing syndrome याद है अच्छे से last test and discussion से. Cushing syndrome में क्या होता है? What is that classical appearance in a case of Cushing syndrome? Moon-like faces is there due to obesity of the face, but centripetal obesity causing which appearance? Lemon on stick appearance. Lemon मतलब बीच का पेट और स्टिक्स मतलब हाथ पैर. तो हाथ पैर उसके क्या होते हैं? एकदम पतले से होते हैं, बट जो पेट होता है वो बहुत ज्यादा मोटा होता है ड्यू टू दैट सेंट्रिपिटल और द ट्रंकल ओबेसिटी. सो कुशिंग सिंड्रोम में भी क्या होता है? एक्सेस ऑफ स्टेरॉइड्स. So here also there are excess of steroids which is causing that truncal obesity in the patient. Along with that, we know which are the most common drugs to cause cataract. Drug induced cataract के most common cause क्या होती है? Steroids. So steroids on a long term are also known to cause subcapsular cataracts in the eye. Okay? So definitely here the patient is talking about features of steroid toxicity, and if he is talking about steroid toxicity, what should be the drug of choice? It should be, first line would be cyclophosphamide. If that was not an option, I would have gone for levamisole. Even that was not an option, I would have gone for mycophenolate mofetil. But first line is cyclophosphamide for this. Okay? याद रखना है बात. Chalo, moving further, question number 2. Here they say we have a 60-year-old smoker who came with a history of painless gross hematuria for 1 day. Which is the first line investigation in this condition? Gross मतलब कम या ज्यादा? बहुत ज्यादा hematuria है. ठीक है? What you would like to do? चलो. Now most important is, please remember guys, यहाँ पे क्या suspect कर रहे हो? What is your provisional diagnosis? What are you thinking of? What can be there? कोई तो बोला CA bladder or CA kidney, right? Because both these conditions can present with gross hematuria. तुम बोलोगे sir stones? Yes, stones can also present with gross hematuria, but stones will present mainly with pain. Painful gross hematuria is a characteristic feature of kidney stones or bladder stones. That is rather the most common symptom of kidney stones or bladder stones. But here they have clearly mentioned that the patient is suffering from a painless gross hematuria. So I need to think in terms of malignancy or a cancer, which in the initial stages would be painless. When it involves the nerves or when it entraps the nerves, जब nerves को compress करेगा, तब जाके patient में pain experience होगा. Unless and until that, the patient will have a painless hematuria only. There can be abdominal mass, there would be a painless gross hematuria, and in later stages there can be pain. So this is classical triad of a renal cancer, classical triad of a bladder cancer as well. Okay? So important. Here most likely I am thinking in terms of cancer or malignancy. Though I am not very sure. See, I am not very sure. But any which ways, they have not asked you the investigation of choice. Na? They have only asked you what is the first line investigation. So when a patient comes to you with some urinary complaint like hematuria, won't you like to confirm it? You will like to confirm na hematuria, the urine is appearing red or brown or cola colored urine is there. You would like to confirm now whether it is a case of hematuria or it is a case of hemoglobinuria or it is a case of myoglobinuria. ठीक है, anything can be present in the urine which can make the color of the urine red, brown or black usually. ठीक है, तो किस किस में होता है ये बता दो जल्दी से. Usually if the patient is having a cola colored urine, है cola colored urine, that is a feature of hematuria. ठीक है, that means it is usually seen in a case of nephritic syndrome. Next patient, nephritic syndrome लिख देता हूं, or it can be even cancer or malignancy in the patient, right? Or even stones in a patient. If the patient was having brown colored urine, what are you thinking in terms of? Array? Brown colored urine is suggestive of a myoglobinuria. That means there is presence of myoglobin inside the urine. Where is this protein myoglobin present? It is present inside the muscles. Now, when the muscles will be broken down, when they will be crushed, then this myoglobin would be released into the blood and then it will be filtered by the kidneys. So, usually myoglobinuria is a feature associated with crush injury which causes rhabdomyolysis. Rhabdo matlab skeletal, myo matlab muscle, lysis matlab breakdown. ठीक है. And lastly, please remember, black colored urine की अगर मैं बात करूं, did I say black color urine on standing? I said black colored urine. Already the patient is passing a black urine. The child is not passing a normal urine and then on exposure to air it is turning black. Black colored urine is a feature of hemoglobinuria. ठीक है, it is a feature of hemoglobinuria usually. That's the important funda. And it is usually seen in cases of hemolytic anemias, for example. ठीक है, तो याद रखना है बात. Black colored urine नहीं होती directly. Usually a child passes normal color urine, but on exposure to air, then it turns black into color or it turns black on standing. ये अगर mentioned है, then it is a case of alkaptonuria due to homogenesic acid oxidase deficiency. ठीक है, so that is a different funda altogether. ठीक है, no issues with this now, don't confuse it. Now if I talk about this, तो सबसे पहले if a patient comes to you with urinary complaints, guys, as a physician, please tell me what are you going to prescribe for the patient? Are you directly going for ultrasound? So a lot of people have answered ultrasound KUB. Please tell me 90% of the kidney stones, are they radio opaque or they radiolucent? Radio opaque matlab which are calcified and which will appear on a X-ray or a CT scan. Radiolucent, that means which are usually not calcified and they will not be seen on a X-ray or a CT scan. 90% of the kidney stones are radio opaque or radiolucent? They are radio. Most common kidney stones are? Most common kidney stones type पूछ रहा हूं मैं. Calcium oxalate. Calcium or calcium is radio opaque. How you can say most of the renal stones are radiolucent? Gallstones are radiolucent. Please remember this. Ultrasound KUB would be done for which stones? Only the radiolucent stones. KUB is kidney, ureter, bladder. ठीक है? But it is done for radiolucent stones. And we know majority of the kidney stones are radio opaque. So therefore, we need to go for a first line investigation as a X-ray KUB. If we are not able to find, then what is the investigation of choice for renal stones? This is the first line. X-ray is the first line investigation. Investigation of choice would be a NCCT KUB, right? It is non-contrast CT scan of the kidney, ureter and bladder. First line would be X-ray क्योंकि X-ray पे भी calcified structures दिखते हैं. And then to confirm our diagnosis further, we'll go for a NCCT KUB in the patient. ठीक है? So this is a surgery question, important, very important. Please remember, 90% renal stones are radio opaque in nature. That is the reason why first line is X-ray and the investigation of choice is a NCCT KUB for the patient. Only 10% of the renal stones can be radiolucent, and for them we can do a ultrasound. But again, preferred over ultrasound is definitely a NCCT itself. Ultrasound is definitely the investigation of choice for gallstone, and it is not ultrasound KUB. Over there it is ultrasound abdomen then. ठीक है, तो ये बात याद रख लेना. That's an important feature. ठीक है. If I talk about urine culture, is the patient mentioning about any UTI symptoms? UTI symptoms are urinary tract infection के symptoms like pain during urination or burning micturition, that is burning sensation during urination. Okay, so is the patient mentioning any of this? No. So we are not suspecting a urinary tract infection. If we are not suspecting a urinary tract infection, then why we need to go for a urine culture at first place? So first definitely would be a urine microscopic examination. जब भी यूरिन कलेक्ट करके तुम भेजते हो, यू आस्क फॉर टू थिंग्स. फर्स्ट, अ यूरिन माइक्रोस्कोपिक एग्जामिनेशन. Second, a urine culture. But urine culture is done when a patient is having UTI. Urine microscopic examination is done in any and every urinary complaint of the patient. ठीक है, whether it is hematuria or it is we are suspecting a malignancy or anything else. Okay, even UTIs में क्यों करते हो? Because on microscopic examination of the urine, you will be able to see what? You will be able to see a cells and bacteria inside the urine. तो वो माइक्रोस्कोपी में पता चलेंगे. बट विच बैक्टीरिया इट इज, वो कल्चर करके पता चलेगा. ठीक है, तो बोथ आर सेंट डेफिनेटली. बट इफ दे आस्क यू टू चूज वन, definitely as we are suspecting a cancer, our answer over here definitely should be a urine microscopy for malignant cytology. Okay, that's important one. No issues with this, anybody? So urine microscopic examination can be done for multiple things, for RBCs, for epithelial cells, for pus cells, for bacteria, for malignant cells. Here we are suspecting a cancer, therefore we are sending a urine microscopic examination for malignant cytology. इसका मतलब ये नहीं है कि pathologist will not tell us अगर उसको epithelial cells दिखते हैं नहीं दिखते हैं. Okay, report is complete always. ठीक है, but we are asking him to also look for any malignant cells specifically. ठीक है, याद रखना है बात. हाँ, स्टोन में ये सबसे इंपॉर्टेंट फीचर होता है बेटा, ये वाला. Pain is the most common symptom in a case of renal stone. Whenever the patient will have stone, the patient will have a lumbar or a loin pain, which will be radiating to the umbilicus, or radiating to the inner thighs, or radiating to the base of the penis or the scrotum, or in females to the labia majora, or to the tip of penis. Depending on the location of stone, that will do in surgery because it is a surgery topic. ठीक है, तो depending on the location of the stone, definitely the patient will experience pain. ठीक है, तो पेन इज अ वेरी क्लासिकल एंड द मोस्ट कॉमन सिम्टम इन केसेस ऑफ रीनल स्टोन. ठीक है, याद रखना है बात. तो दिस इज व्हाट इज अ CECT abdomen. Okay, and it is showing what? Here you can see there is a mass which is arising from the kidney. So it is a kidney cancer which is seen in this patient over here. ठीक है, we will discuss about renal cancer and surgery. But this was the basics कि अगर पेशेंट तुम्हारे पास यूरिनरी कंप्लेंट्स के साथ आता है, यू नीड टू सेंड द यूरिन सैंपल्स फर्स्ट फॉर टू थिंग्स. फर्स्ट इज फॉर माइक्रोस्कोपिक एग्जामिनेशन एंड सेकंड इज फॉर द कल्चर. ठीक है, रिसेंट एग्जाम में देयर वाज अ क्वेश्चन ऑन माइक्रोस्कोपिक एग्जामिनेशन एज वेल. ओके, so usually in a normal person there is presence of hyaline cast in the urine. What are these called as? These specific type of proteins which are normally present in the urine, what are these called as? These are called as stam horsefall proteins. Please remember, these stam horsefall proteins are a normal finding in examination, urine microscopic examination of any person. Okay, so that's important. Next, hyaline casts are also a normal finding. Hyaline casts are also a normal finding in examination. Benz-Jones proteins are a feature of? Very good. So Benz-Jones proteins are nothing but these are only the light chains of antibodies. I hope all of you are quite aware. Antibodies are made up of heavy chains and light chains. But in a condition like multiple myeloma, which is a cancer or malignancy, over there is overproduction, excess amount of production of light chains of antibodies. And these light chains of antibodies would be excreted out in urine. Then it would be called as Benz-Jones proteins. अगर वो present है, then it is a case of multiple myeloma in the patient. ठीक है, that's important. Moving further, okay. Red cast are usually suggestive of RBCs, right? And RBCs are seen in a case of glomerulonephritis. Then if I ask you, broadcast are seen in a case of chronic kidney disease or chronic renal failure. Please remember, lipid cast, अभी तो बताया लिपिड यूरिया किसमें होता है? Nephrotic syndrome, right? In nephrotic syndrome, the patient was having lipiduria, na? So in that patient, definitely there would be presence of lipid cast inside the urine. इसके अलावा, there is one respiratory condition where there can be presence of fat globules or these lipid casts in the urine or the sputum of the patient. What is that? Fat embolism syndrome, right? In fat embolism also there is presence of lipids or fat globules inside the urine of the patient. Now that will also lead to the lipid cast. And lastly, WBC cast. They are definitely a feature of infection. That means pyelonephritis in the patient. They are a feature of pyelonephritis in the patient. Okay? These are the uncommon things which most of them will not teach you. And these are appearing in the examination. Okay? So that's important. फैट एम्बोलिज्म सिंड्रोम वो इंजरी के बाद जो होता है उसी को बोला जाता है. विल डिस्कस दैट. ठीक है. No issues with this, anybody? So these are the important things to be remembered about urine microscopic examination. ठीक है. Crystals के बारे में and the type of stones that we'll be discussing in surgery. Moving further, question number 3 now. It says a 35-year-old lady, classical Sarkari question of your examination. 35-year-old lady is having complaints of bilateral drooping of eyelids, and drooping of eyelid is called as ptosis. Drooping of eyelid is known as ptosis. Okay, the patient is not able to open the eyes because the eyelids are drooping down. And when the patient experiences this ptosis, only when there is some trigger. What is that trigger? If the patient is watching television or the patient is usually using TV, laptop, mobile phone for a longer period of time. ठीक है. So these are acting as trigger factors. हमेशा नहीं रहता. याद रखो ये बात. Second, the patient is also having chewing muscle weakness and shoulder girdle weakness. Okay, the patient is having shoulder girdle and chewing muscle weakness. ठीक है. Which progresses throughout the day. Classical feature. Progresses throughout the day मतलब the symptoms of the patient will worsen towards the evening. Symptoms कब ज्यादा होंगे? In the evening as compared to the morning. ठीक है. So definitely the patient will have symptoms more towards the evening as compared to the morning. ठीक है. Which of the following is the investigation to confirm the diagnosis of this patient? Now, what is the provisional diagnosis? Shabash. All of you are right. It is myasthenia gravis. Now, myasthenia gravis, we know. Myasthenia, that means weakness of the muscles. Okay? The patient will have weakness of not only the facial muscles, but all the muscles of the body. Okay? Including the extraocular muscles. Every muscle of the body will be weaker. Why? Because muscles are not able to contract. And why these muscles are not able to contract? Very good. So, for example, this is your neuron and this is your muscle. This junction is called as neuromuscular junction. At the neuromuscular junction, what happens? The neurons will release a neurotransmitter called as acetylcholine. This acetylcholine should go and to bind to the receptors. When this acetylcholine will bind to the receptors, then the electrical impulse or then the signal would be transmitted to the muscle. Okay, so this is the neuron, this is the muscle. And once this electrical impulse goes inside the muscle, then these muscles will contract. But what happens in myasthenia gravis? Myasthenia gravis is which kind of a condition? It is an autoimmune condition. What do I mean by autoimmune condition? Here the patient will have some autoantibodies. What do I mean by autoantibodies? The type of antibodies which will attack our own body. ठीक है. The antibodies, self destructing antibodies या the antibodies which will attack our own body. तो अपनी बॉडी में किसको टारगेट करती है antibodies? They will target the acetylcholine receptor. So these are anti-acetylcholine receptor antibodies. Now as these anti-acetylcholine receptor antibodies are present, what they will do? They will damage the acetylcholine receptor. As they will target and they will damage the acetylcholine receptor. Can the acetylcholine bind? No, the acetylcholine cannot bind now. And can the electrical impulse be traveling to the muscle? No, the impulse could not travel to the muscle. अगर muscle में impulse जाएंगी नहीं, तो muscle contract हो पाएगी क्या? नहीं, the muscles are not able to contract, and that is the reason why patient experiences muscle weakness. This is the basic idea behind myasthenia gravis. ठीक है, रटना नहीं है बस. antibodies, antibodies क्या करती है? Acetylcholine. Problem ये था, in one of the examination they gave an option acetylcholine deficiency and people started marking acetylcholine deficiency. No, acetylcholine is not deficient in cases of myasthenia gravis. It is deficient in Alzheimer's disease. Acetylcholine is in enough amounts, rather in increased amounts. The problem is with the receptors. Receptors are defective, so acetylcholine cannot bind. ठीक है, तो ये याद रख लो ये बात. No issues with this, anybody? Now, so this is a case of myasthenia gravis. what would be the feature? Usually it involves the middle-aged patients. More commonly, males are involved. Here it is an example of a lady. More commonly, unilateral drooping is there or unilateral tosses is there. Asymmetrical unilateral tosses. एक आंख में tosses होगा जैसे इस अम्मा में दिख रहा है अपने को यहाँ पे, ठीक है, ऐसा होगा drooping of eyelid. But bilateral tosses is rare in a case of myasthenia gravis. But in examinations they have mentioned bilateral, so I have included bilateral in your question. Now, please tell me what is the investigation which will confirm the diagnosis of the patient. If I talk about option A, first of all, anti-PIQ voltage gated calcium channel antibody titer. So this anti-PIQ voltage gated calcium channel antibody titer would be done in a case of Lambert-Eaton syndrome. Lambert-Eaton syndrome may also the patient has muscular weakness, but over there the muscular weakness is why? Because in this definitely on the